Emergency room medication error leading to cardiac arrest and unnecessary intubation. What families must know. My name is Patrick Hutzel from IntensiveCareHotline.com, where we instantly help families of critically ill patients in intensive care make informed decisions, get peace of mind, control, power, and influence, even if you're not a doctor or a nurse in intensive care, so that your loved one gets best care and treatment always. And where we break the cycle of hospitals telling you you have no choice. So, last week I had a concerned relative of a family member in ICU shared a shocking experience that raises serious questions about hospital standards of care. Here's what's happened. Patient walked into ER on their own. They were given an intravenous drip, but the medication they received triggered a cardiac arrest. The patient coded, was resuscitated, and then, without any clear or justified medical reason, was intubated and placed on a ventilator. So I'll just read out the original email from the reader who says, "Sorry, Patrick, to be so blunt, but I seriously believe something is very wrong with this hospital. My family member walks into ER, is given an IV drip, and then because of the medication administered, goes into cardiac arrest. The patient codes, is brought back, and then is intubated without any clear medical reason. From what I've seen, this seems to be what the so-called," and he puts in quote, "training personnel here do, and it is deeply concerning." Now, from what was described, this wasn't an isolated case. It seems that at this particular hospital, inexperienced or quote-unquote training personnel are performing high-risk interventions as routine practice, even when they may not be medically warranted. This is, of course, unacceptable. Families need to know they have the right to question every intervention, request a full explanation of the medical reasoning, and demand senior oversight, especially when it comes to intubation, mechanical ventilation, and ICU admission. However, what is really important in a situation like that is what I've been saying for over a decade now here on this channel. You need two things. You need a second opinion at all times, which is what we can give you here at IntensiveCareHotline.com. But you also need access to medical records, and you need access to medical records and that second opinion from day one. You know, you can't afford to fly blind if you have a family member in ICU or in ED. You know, that is just sheer craziness, and that is something you can control, right? So if you are facing a similar situation, don't wait for the hospital to explain it later. Get access to medical records now. Get me on a call with a hospital, with the ICU team, with the ER team, so that I can ask questions with you and on your behalf. And you will see the dynamics change and shift very quickly, right? So that you're not running into trouble in the first place, because you must ask questions now, not later. You know, request full access to medical records, which includes the medication list, the sequence of events, and to authorize each step of the way. You have a right to transparency and to protect your loved one from unnecessary harm at all times. Not doing so borders on madness, right? Whilst I believe most hospitals have, you know, patients' interests at heart, not all hospitals do, unfortunately. So it is up to you to take the necessary steps to protect your loved one during critical illness. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at IntensiveCareHotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, you know, and you can verify that on our testimonial section at IntensiveCareHotline.com, and you can verify it on our IntensiveCareHotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.